Hello, my friends. So on my channel, we frequently and thoroughly examine the role that male sex hormones play in male pattern baldness. It has been known for a long time that genetic follicular sensitivity to androgens is the biggest culprit in male pattern baldness. We know this because eunuchs, with the exception of Jason Blaha, do not go bald. But what about female sex hormones like estrogen and progesterone? Do they have any protective role against male pattern baldness? If so, can they be utilized in a way that doesn't compromise male virility? That is what we are going to explore today. So let's start with the main female hormone, estrogen. So, anyone who has passed elementary level biology doesn't need a comprehensive overview of what estrogen is. It is the main female hormone produced primarily in the ovaries that is responsible for the development of primary and secondary sexual characteristics in women, like female fat distribution, breast development, and skin texture. It is also produced in small amounts in the adrenal glands, so even though it is a female hormone, men still do produce a small amount of this hormone, and it plays an important physiological role in men in terms of promoting joint health and protecting against cardiovascular disease. Conversely, women also produce a small amount of testosterone, which is important to prevent muscle wastage and for libido, which is why some women will use a small amount of testosterone to treat conditions like hyposexuality, which is low sex drive. Now, even though hair loss is obviously much more common in men due to the role of androgens, we know that women can experience hair loss that is caused by the same mechanism that affects men, although it is much less common. Women can also experience hair loss due to other factors like an impaired thyroid, metabolic syndrome, alopecia areata, telogen effluvium, and in rare cases due to malnutrition, but female pattern baldness is still the most common form of hair loss in women. In fact, only 43% of women over the age of 80 will have no signs of female pattern hair loss whatsoever, and the main culprit is still androgens, even if they produce fewer of them. But is there more to a woman's internal chemistry that explains why hair loss is less common in the fairer sex? Well, to better understand that, let's take a look at female pattern baldness. So first of all, female pattern baldness is effectively the same thing as male pattern baldness. The mechanism is the same. The only difference is the chemistry of the sufferer. Women who have elevated levels of androgens through conditions like hyperandrogenism or hirsutism are thus more likely to experience male pattern or female pattern hair loss, but the condition can still affect women with normal baseline female androgen levels. Now, when measuring female pattern baldness, physicians will rely on what is called the Ludwig scale, which is distinct from the Norwood scale, which is used more often to grade the severity of male pattern baldness. The type of hair loss women experience with the Ludwig scale is more typically associated with what we know as diffuse thinning, although men with androgenic alopecia can also be diffuse thinners, and women who lose hair women can also lose hair in a typical male pattern baldness fashion, which is when hair loss begins at the crown and temples until they eventually meet, as opposed to just losing hair all over, which is more common with diffuse thinners. So, even though we know that elevated androgen levels in women can make female pattern hair loss worse, such as in conditions which cause elevated androgen levels like hirsutism, or in the case of women who abuse performance-enhancing drugs, the cause behind female pattern baldness isn't as well understood, since it has been shown that women, even with suppressed androgen levels, still tend to lose their hair, and the theory behind this may have something to do with the role of female hormones in hair loss. Now, finasteride, which I always recommend people use as their frontline defense against male pattern baldness, it's a commonly used drug by men since it can indirectly stop the conversion of testosterone into dihydrotestosterone, DHT, and DHT is, of course, the main male hormone which causes hair loss, and it does so by binding to the androgen receptors of the hair follicle and causing miniaturization. This conversion also occurs in women, but women cannot safely use finasteride due to the fact that it can cause birth defects, and most doctors would probably not even prescribe it off-label to a woman unless she's post-menopausal or she's had a hysterectomy. So finasteride is definitely not FDA approved for women. A woman can, however, directly inhibit androgens through the use of a oral anti-androgen like oral spironolactone. However, spironolactone is a diuretic and must be used at high dosages, usually over 100 milligrams, to get an anti-androgenic effect, which can lead to some discomfort reporting side effects such as frequent urination and possibly electrolyte imbalances. And also, the suppression of androgens in women can lead to hyposexuality, which can cause distress in relationships potentially. And there are other oral anti-androgens as well, like flutamide, but usually they're pretty toxic to the liver, so they can't really be used long term. So, what is the difference between men, except for Jason Blaha, and women? It's estrogen levels, of course, and estrogen is actually produced by conversion of testosterone and androstenedione into estradiol via the aromatase enzyme, which is produced in the ovaries and is active on many regions of the body, including the scalp, and even more so in women than in men, which may indicate that estrogen has a protective role in combating hair loss. The protective mechanism of estrogen is further strengthened by observational data on women who are post-menopausal, as they are far more likely to experience hair loss despite not having any increase in androgen levels with age. So the only change in their chemistry really is the drop in female hormones like estrogen and progesterone. So can female hormones like estrogen be used to treat hair loss in women? And furthermore, is it possible for them to be utilized by men without compromising virility? So we do know that a complete or nearly complete suppression of androgens will halt any further scalp baldness, but it won't do much to actually regrow hair, and that is why doctors will often recommend combination therapy with finasteride and minoxidil, since that typically does more to promote hair growth than mono treatment with finasteride. So in the case of using estrogen combined with an anti-androgen like spironolactone, there have been reported cases of substantial hair growth. Now, looking at a case study, which I'll link below, it involves a 33-year-old transgender woman who was treated with 5 milligrams of estradiol and 150 milligrams of spironolactone, which is a commonly used anti-androgen for trans women. Before treatment, she had a baseline testosterone level of 455 nanograms per deciliter, which is normal, albeit on the fairly low side of normal. And after 6 months of hormone replacement therapy, she got down to 11 nanograms per deciliter, and her estrogen levels were 92 picograms per milliliter, and a picogram is even smaller than a nanogram, but that still reflects normal female physiological levels of estrogen. Now, hair counts weren't measured using anything like an instrument like a phototrichogram, so we can't get an exact hair count measurement, but observing the photos, she was a borderline Norwood 5, so she had severe hair loss before beginning treatment, and she went all the way up to a Norwood 3 after just 6 months, so she gained 2 Norwoods in 6 months. I mean, that's pretty remarkable, and it's likely she was too far gone for a complete reversal of hair loss, but substantial regrowth was noticed, and you can look for yourself because the study has pictures in them. But the researchers from clinical experience felt it was necessary to suppress both testosterone and to elevate estrogen levels to get this kind of regrowth, as opposed to just suppressing androgen levels alone. Another piece of evidence that supports the role of estrogen in preventing hair loss is the typical patterns seen in hair loss in women. Now, like I said at the beginning, it is possible for women to lose hair in the standard male pattern baldness fashion, which can often begin at the hairline, but oftentimes with female pattern baldness, as seen with the Ludwig diagram, the hairline is actually spared. An explanation for this is that in the frontal hairline of women, there is a higher level of aromatase enzyme which synthesizes estrogen when compared to the rest of the scalp. This may result in local higher scalp estrogen levels along the hairline. Men lack this, which may explain why the hairline is such a big problem for many men. This again, I think, is evidence that estrogen has a direct hair-sparing effect. Now, in practice, estrogen and oral contraceptives which contain estrogen and progesterone can be an effective means of treating hair loss in women, even though the data is limited, and there are of course some potential risks, namely an increased risk of breast cancer and heart disease in the case of post-menopausal women. However, contraceptives, while not completely risk-free, are generally considered safe in premenopausal women. Estrogen used to be given routinely to postmenopausal women, but now these days it is rarely prescribed due to its known risk, including risk of stroke, breast cancer, blood clots, as well as heart attacks. Interestingly enough, these risks are not seen in premenopausal women, so maybe this is just nature's way of saying stop with the damn estrogen after menopause. I mean, who knows? Now, what about for men? Well, unless you are having gender identity issues, you probably don't want to take oral estrogen, but could estrogen be applied topically to the scalp to give the hair the benefits of estrogen without systemic absorption? Well, I have already mentioned alpha-estradiol many times in my videos, and alpha alpha-estradiol, as the name implies, is a weak estrogen. It's like a weak estradiol, and it has been shown to promote hair growth slightly below par of 2% minoxidil. Although being that alpha-estradiol is hormonal, it may be a better long-term treatment than 2% minoxidil, which is just a hair growth stimulant. Alpha-estradiol, however, is not like the estrogens our body produce naturally. It is designed not to be absorbed systemically. So, what about actual topical estrogen? Can that be used without systemic absorption and side effects? Sadly, the answer is no. Estrogen, when it is applied to the skin, is absorbed into the skin, and then it's absorbed into the bloodstream, and topical estrogens are even prescribed to women for the purpose of hormone replacement therapy. So, if you are a cisgendered male, you don't even want to touch estrogen, not only because it causes feminization, but there are numerous studies, one of which I'll link below, which show that estrogen has a causal role in the development of numerous diseases like heart disease, stroke, prostate cancer, blood clots, and peripheral artery disease in men. So even though it does appear estrogen has its benefits, you don't want to touch it with a 10-foot pole if you're a guy. And even if you are a trans woman who wants to start estrogen, you'll want to make sure you don't self-medicate and that you consult with a doctor to see if you have any underlying health problems that would put you at risk before starting therapy. Now, it may sound crazy, but I have actually seen men get so desperate to stop their hair loss that they've thought that they need to experiment with estrogen, both topically or at low doses orally, but the risks are just not worth it. So if you are a premenopausal woman, your natural estrogen and as well as the estrogen in your birth control pills may be actually benefiting you by preventing hair loss, besides the obvious benefits, of course. But if you are a post-menopausal woman, it probably isn't worth the risk. I mean, it may help you, specifically if you have female pattern hair loss, but the numerous health problems that you can develop make it very risky. So if you want to try it, go ahead, but by all means, check with your doctor first. So if you're a guy and you want to try estrogen to fight hair loss, alpha-estradiol is probably your only safe choice. But actual full-blown estrogen is not a viable option, sadly. So, all right, guys. That's all I wanted to touch on that subject. I'll see you next time.